Hi, my name is Josh Allbright, and I've been doing my internship at the PRISM Center. The PRISM Center serves individuals with diagnoses like borderline personality disorder, bipolar disorder, anxiety disorders, major depressive disorder, and schizophrenia. Typically, an individual who would come to the PRISM Center may have just been released from an inpatient hospitalization stay, and they require an intensive outpatient program to help acclimate themselves to the outside world. The center focuses on dialectical behavioral skills therapy to teach life skills and mindfulness to cope with the diagnoses, the serious diagnoses that many of our patients have. The center offers intensive outpatient therapy 4 days a week for 2.5 hours per day. That's led by a single therapist, and the first portion of the session is devoted to skills, and the last portion of the session is devoted to check-ins, where each group member can get some feedback. This treatment consists of dialectical behavioral therapy and cognitive behavioral therapy. After a person would go through IOP, then they might do aftercare in a once-a-week dialectical behavioral therapy group. Those last for 1.5 hours per session. There is also a once every other week aftercare group that is primarily check-ins. My center caters to a more affluent clientele. It only accepts a limited number of insurances, about 3. And if you want to self-pay, which many patients do, it's $788 per week for intensive outpatient, and $125 per week for DBT. Included in IOP is one individual session per week and family sessions as needed. Also, if a participant is a young adult, my center offers a parent group once a week, free of charge, where the parents come in and receive the same skills training that the young adults are getting, and and they learn how to communicate more effectively with their young adult. We only see patients 18 and up. It is rare, but occasionally we will get a 16 or 17-year-old, but in groups they must be 18 and up. Individuals and family therapy done outside intensive outpatient is all self-pay. They don't accept any insurances. Some of the strengths of my facility are that the therapists are supported by a treatment team. That's done once a week on Tuesday mornings, where difficult cases are staffed. It's a supportive and validating environment for the staff and for the patients. It is a financially sound, stable, and profitable business that also happens to provide high level of care. And DBT is a sought-after treatment modality and is proven to be effective. A couple of the weaknesses of my site are that there's no medical or psychiatric staff here, so all of those needs have to be referred out. There's some limited resources for underserved populations. We do some discounting, but overall, if you can't afford the treatment, you're probably not going to get it. And the staff focus here is to prevent hospitalization, so sometimes that might lead to a situation that could be a little bit dangerous. Just overall, what I learned from gathering this information is how hard everybody works to work together here, and I don't feel like there's anything else I needed to know to do my presentation. Thank you.